Venetoclax, the BCL2 inhibitor, is approved for patients with 17p deletion CLL who have failed a prior therapy. However, it is extremely active not only in that population, but in all patients with CLL, and is one of the most active drugs for that disease. It gets not only clinical remissions and hematologic remissions, but a substantial proportion of patients become negative for minimal residual disease. Early on in the development of the drug, there was an incidence of tumor lysis syndrome, including a couple of unfortunate fatalities. The company developed a ramped up dosing schedule. So the patients start at a lower dose and eventually get to the appropriate dose. And since that has occurred, tumor lysis syndrome has been quite manageable. In particular because we grade patients low, intermediate, and high risk for tumor lysis syndrome. Low risk patients can be treated on an outpatient basis with just some hydration, intermediate outpatient and maybe some inpatient. High-risk patients need to be hospitalized for a day or two to get hydration, prophylaxis with a drug like rasburicase, and to have their tumor lysis syndrome laboratory studies checked every 6 hours or so during the first day of treatment. Since this has been implemented, the drug has been given relatively easily, and other side effects are quite minimal. It's a well-tolerated, extremely effective drug. It is now being developed in combination with a number of other agents, and hopefully it will get more widespread use because it is a well-tolerated and highly effective drug for patients with chronic lymphocytic leukemia, not just those for the FDA-approved indication of 17p deletion.